The Frisco Fire Department is prepared to keep firefighters safe when dealing with any potential infectious disease, including COVID-19, during the coronavirus pandemic.
Where we're currently at is a level 2 protection for the COVID, which is an N95 respirator, gown, gloves, and eye protection. Any of the folks that screen positive through our dispatch screening, our providers will don the level 2 protective equipment before they make contact with any of these patients.
Paramedics can also contact a patient over the phone to ask additional questions before they make contact with that patient.
We're limiting the number of providers that encounter that person when they screen positive. So as long as there's no life-threatening situations in hand, only one provider will make contact, assess the patient, determine their medical needs, and then make decisions appropriately.
The department also has backup plans to protect paramedics.
If we run out of supply of our N95 respirators, then the next plan is to use our SCBA face piece, which is what we use for firefighting operations, with a filtering canister instead of supplied air. So that is a step 2. We can also use the PAPR, Powered Air Purifying Respirator. We have deployed 2 of those on each ambulance, so our folks can put those on in the event that a mask is not available.
Once a crew returns after transporting a possible infected patient, the ambulance is cleaned inside and out along with paramedics. Their clothes are washed and the ambulance decontaminated.
We're going to decon the exterior of the ambulance and then on the interior of the ambulance, so all surfaces that could possibly have been touched. To do that, you can use this machine. We set up this wand and use whatever disinfecting solution that you choose, and you're just going to start spraying every surface wherever it may have been touched.
To clean the inside of the ambulance, there's a built-in hose so firefighters do not have to get inside the vehicle.
We have a remote control that we can start this with, or we can just push the button. This will run for 6 minutes. The whole back of this ambulance will be fogged.
The ambulance then sits and disinfects as the decontamination solution dries. The whole process takes about 30 minutes. The ambulance is then ready to go back into service. Procedures are also in place to make sure all firefighters are healthy.
We recognize that an important part of our continuity of service is keeping our firefighters healthy. So we've implemented temperature checks at the start of each shift and then mid-shift to make sure that our folks are not symptomatic while on duty. We've also discontinued any trainings, any classes, any activities that would bring large groups of folks together at any one time. We ourselves are adhering to all the CDC recommendations to limit exposure to crowds, and so we're doing our best to isolate our firefighters from those types of events and preserve their ability to respond to 911 calls.
For answers to your questions or more information about COVID-19, go to friscotexas.gov/coronavirus.